Assalamu alaikum, ma'am. I'm Faizan from final year.
And I'm Ali Reza from final year.
Okay, ma'am. So, as a Surgeon General, you oversee the medical services of the Pakistan Army. So, how has your medical background had an influence on the military healthcare and well-being?
When you, of course, it has a huge impact, because if you're not from medical, then I don't think you can decide for medical once you don't know about the medical and don't know about the limitations, and you don't know about the strengths of the medical code. So I was the person, of course, you go to that position stepwise. So you know all the limitations that you have, and you know all the resources that you have, and you also know what kind of help you can do to your people and to the medical code. So when I became the Surgeon General, I knew that HR is limited. HR is limited because army is limited. There's a certain bracket. You can't increase army beyond this bracket. So if you can't increase that bracket, because out of that bracket there is a certain portion that is medical code. So you can't increase it because there are so much challenges for the other armed forces, because there is a CPAC going on with newer formations, and there are so much more going on. There are operations, the cross LOC firing, and there are so many other things. So you can't reduce them to increase yourself. So the limitation was HR. But then there was so much that you could do. So then when you know all this, you can do the best decisions for your healthcare. So I thought, why not enable this HR? And how can you enable them? To give them more equipment, for example, so that they can easily diagnose things. The patients are not shuffled from one CMH to another CMH. If you are enabling the peripheral CMHs, if you are giving them more CT scans, you are giving them more oxygen generation plant, tanks or whatever. And secondly, you train this HR. So when you train them better, so they would do better. And you train them not just that the patient should benefit, but they will also benefit. And then the quality education will build the difference in the healthcare that you want to do there. So I worked for that education also. I worked for the hospitals and the patient care and all those also, but I also worked for this healthcare. So what did I do? I worked for the paramedics, that is the Allied Health Sciences Act there. And then I changed I went to UK and USA to study for a week there and a week there to study their system. So I realized that they are more competency based while we were more curriculum based. So I thought, yes, this is right, paramedics should be competency based. And then changed the curriculum. Yes, it was not only me. There was a whole directorate, and then the center that was working with them. So all this was changed, and then their curriculum was changed, their periods were changed, and now for the first time they will be getting diplomas after 2 years, and they are getting certificates after 1 year. And then this would benefit them, because if they are recognized, there's a national body of NUMS that would recognize them. So if they recognize them, they are registered with that. So then they would be recognized anywhere in the world, because that would be a university TAPA or a degree or a diploma that they will have. So then that would be affiliated world over. So I would like to send a OTA or somebody to go for some training abroad. But when you don't have that accreditation, how can you go for that training? If you are a doctor and you don't have a degree, how will a world accept you for any training? So similarly for them, now they can go and they can be trained. And even after retirement, they can work anywhere that they want to. There is so much demand in the world. Similarly for nurses, I realized that we need to have more nursing colleges. But when you have more nursing colleges, all right, I said, for the first time in Army, I included the civil nursing cadet also, that they can study with us like doctors, and then they can go back in the national grid, and then they can become national asset. So all right, I included them. I started it, but I said if I want to expand it, I can't, because I don't have that kind of instructor nurses. And for an instructor nurse, half of them have to have MSc. we can't have MSc. Why don't we have MSc in anywhere? There's hardly any MSc going on anywhere in Pakistan, or Aga Khan and one or other place. And so I said, why can't we have them here? And I realized for MSc, you need to have a PhD nurse. So where is a PhD nurse? There is no PhD nurse. So what did I do? Sent one abroad for a PhD and one to Aga Khan for PhD. They came back. So with that, I started the MSc nursing school through NUMS. So now I have 30 nurses who are actually studying. So after 1 year, they will come out. So when they come out, I will have more nursing colleges. So you have to think like that to increase your health. It is not that you want to have a nursing school and fine, you build a building and it will start. No. From where do you get the faculty? How do you train them? And second question would be, which hospital they will be getting trained? That you will get. You have a lot of hospitals, but you don't have faculty. So I work for those also. Similarly, on the medical side, there was no infectious disease training somewhere. We started that. And then I wanted a fellowship in family medicine. But I couldn't start it. I couldn't start it because they said you need to have an FSc in family medicine. When the fellowship is not there, training is not there in whole of Pakistan, because there is no fellow of family medicine in the whole of Pakistan, how you get to start the training? So then I went to CPSP, and then was Professor Shoaib Shafi was there, and I said, ये अंडे और मुर्गी में से कोई चीज़ तो पहले शुरू करनी है ना. We don't have them in Pakistan. Even I am an MCPS family medicine because there is no fellowship. So if we don't have a fellowship, where do I get a faculty of a fellow? So then he agreed to one faculty who had a degree in family medicine from UK. So with that, we started that fellowship. So now we are going to have more and more. So, but that we have to work for these things also. If we want to improve our healthcare, we have to improve the healthcare providers by themselves, whatever level they are. And secondly, we have to improve our hospitals and caregiving to improve this. Although we can't increase the number, but we can increase the quality.
Ma'am, throughout your career, you have held various leadership positions. Could you share some insights into your idea of leadership qualities that one must have?
Well, in army, we say there is a leadership and there is a management. So management is like a person with authority who manages other people, who directs other people to do this or to do that. And leader is a person who has a vision and he gets along, he leads the people into something. So in army, it's more of a management and less of a leadership. But now, there's a concept for so many years that the leadership and management is connected, it is not separate. In management, you have to do leadership to make people realize what you want to do or what the boss wants to get done and how to get it done. You have to lead them into that goal. So it is a leadership. So I feel the best part, what I have learned is stop looking at other people. Stop criticizing others. Do what you can do. If you are given a responsibility, do your responsibility and do it with the best sincerity and passion. Don't look towards others that he should be doing this, Flan should be doing that, she is not doing that. If you stop doing that and you concentrate on your own work, that first you lead yourself into that goal, and then the people would be automatically motivated by your sincerity and your passion, and they would follow you. They would follow you into that. But you have to do it first, rather than criticizing the others.
Ma'am, collaboration between different sectors is a very important part for a nation's development. So how do you foster collaboration between the medical corps and the other sectors of the Pakistan Army as well as the civilian institutions?
Yes, I'll give you an example. I think this is very, very important. The army, other sectors, they're almost, they have everything that they want. So they can, even if they don't want to collaborate, they go on. But medical corps can't. For accreditation is being, or for undergraduate would be done by PMDC. Is PMDC army? It isn't. Your specialists are accredited by whom? By CPSP. Is that army? No. Your nursing would be by accredited by whom? By PNC. Is that army? It is not. So medical corps has to collaborate, whether it likes it or not, with the civil and also with the army. Where do I get logistics from? The logistic that our health, the medical setup gets is from the army. So you have to collaborate with them. If you don't, then you are nowhere. For example, we had Corona, and there's a whole logistic branch that gives us, that's provide us medicine and so many other things. And every day I was saying, I need vaccine, I need vaccine. And they said, the vaccine is not available at the world level. You remember initially there was no vaccine. Yes. And then there was Pfizer and they banned it to be given it to the East. So before that, even much before that, I had realized they would not give it to us. So I said, Pfizer is not going to give us the vaccine because they have a huge America to give it to. They have a huge Europe to give it to. Before they give it to us, we are not the priority. So we have to take it from the China or from the Russia or from this side. So then we have to collaborate with them. So we got the vaccine even before many of the countries had. So you have to collaborate because you are the health care provider for the army and also for the civilians. But then you have to collaborate to get it. So without collaboration, I don't say it is just intersectorial in the national level, it has to be at the international level. If you don't have those setups, you are not going to get it. So you have to keep those relationships intact, even otherwise when you don't need them. Because you don't know when you need them.
And the role of military is constantly evolving. How do you see the role of women in military changing over the decades?
Yeah, that's true. The army was there even before Pakistan was made. And then the Indian army, the part of that came to Pakistan was Pakistani army. So we had Pakistan army from the beginning, but there was no ladies. The ladies came to Pakistan army in 50s. So it evolved. So we had females. And then they slowly and gradually they increased into other sections. When I was a captain, so I wanted to become a cardiologist. That was my passion, to become a cardiologist. But I was not allowed because I was a female. So they couldn't even accept this, that the female can become a cardiologist or she should be allowed to become a cardiologist. So I fought for 10 years, but I was not allowed to. Although I'm very happy I was not allowed to, because Allah had bigger destiny for me. So I was given something bigger than that. If I was cardiologist, I couldn't have become a Surgeon General of Pakistan Army. So I said I am a very strong believer of Allah. But I was talking about females. But when I fought, so then they start thinking on those lines. So it was General Wahid Kakad, the chief of that time, who decided that yes, limited females should be allowed to come into specialty. So their seats should be limited so that they do not take over the males, but they should be given some seats on competition. So the seats were given, and now we have females and all. We have a female who is a cardiac surgeon, and there are females in surgery, and there are females in so many other fields other than the medical setups. So we couldn't even think of this back that time. So it is evolving, and I feel females coming up very strongly. Beware.
What initiatives should be taken to support their progress?
Yes. Male have to take that supporting role. Whether they are fathers, whether they are brothers, whether they are our husbands, they have to actually empower their women. And by empowerment, I don't mean that there should be something like equality or no, they have different roles. So you can't be a mother, so no equality. They can't be something else. So there are so many differences. But for me, what empowerment is, the power to decide. If your daughter wants to go to an engineering, why not? She should be empowered to decide for at least her education. Then she should have a decision to do a job. If she wants to do a job, why not? If son can do a job, why can't a daughter do a job? You are asking your son repeatedly, whom do you want to marry? And you, when your daughter says that I don't even want to marry this person and you are annoyed, this is her right. And this is what Islam has given her that right. So at least give her the power to make at least the important decision of herself. Similarly, when you are husbands, even then, you don't let her do so many things. Why not? Drive nahi karna, kyun nahi karna? So what is wrong with it? So if you support your females and you empower them into their decision making, so they are going to do wonders. Half of the time they are scared of men that are there to protect them. So why should this happen?
Thank you, ma'am.
Thank you very much.
Thank you.
Enjoyed the interview.